Hi, it's Grace from Nurse Made Easy, and today we're talking blood flow through the heart. Let's go. Now, I know that the concept of blood flow through the heart can be overwhelming for some, so I plan to make this very easy to understand. Now, to understand how blood flows through the heart, it's important that we briefly review the basic structure of the heart. Now, the heart is a hollow muscular organ and it's located between your lungs and behind the sternum. The average human heart is about the size of a fist and it beats at an average rate of 80 beats per minute, with a normal range between 60 and 100 beats per minute at rest. The cardiovascular system, so cardio meaning heart and vascular meaning blood vessels, is made up of the heart and the blood vessels. And the blood vessels include the arteries, the veins, and the capillaries. The goal and the job of the cardiovascular system is to circulate blood through your body, and blood brings oxygen and nutrients to your body tissues. Now, generally, arteries transport oxygenated blood, so oxygenated means oxygen-rich blood, while veins transport deoxygenated blood, which means oxygen-poor blood within the body. However, there is an exception to this when we consider the flow of blood through the heart, which I will discuss later in the video. Now, the heart has four chambers, so two atria, which are the upper chambers of your heart. So that includes the left atrium, the right atrium, and the two ventricles, which are the lower chambers of your heart. So we have the left ventricle and the right ventricle. The two atria are responsible for receiving incoming blood, so they act as reservoirs, while the two ventricles are responsible for pumping blood out of the heart to the rest of the body. Now, we have four valves that control the flow of blood through the heart. Now, the primary goals of these valves are to control blood flow so that it moves in one direction, which should be the right direction. Now, these valves also help prevent blood from flowing backwards or regurgitating. The first valve is the tricuspid valve. The tricuspid valve separates the right atrium from the right ventricle. So to remember this, use the mnemonic RAT. So R is for right, A is for atrium, and T is for tricuspid valve. The tricuspid valve also has three cusps and leaflets, hence its name. The second valve is the bicuspid valve, also known as the mitral valve, and this separates the left atrium from the left ventricle. To remember this, use the mnemonic LAB, so L for left, A for atrium, and B for bicuspid valve. The bicuspid valve has two cusps or leaflets, hence its name. So use the mnemonic LAB-RAT to remember which valves are between the atria and the ventricles. Then the third valve is the pulmonic or the pulmonary valve, and this separates the right ventricle and the pulmonary arteries. Use the mnemonic RV's pulvans, RVPV, which represents right ventricle and pulmonary valve. And finally, we have the aortic valve, which separates the left ventricle from the aorta. So use the mnemonic, look Vera, a van, which represents LVAV, left ventricle aortic valve. So now that we've reviewed some basic structure of the heart, let's review how blood flows through the heart. The first place blood goes into is the right atrium. So deoxygenated blood, which is oxygen poor blood, flows from the body through two large veins called the superior vena cava, which is at the top, and the inferior vena cava, which is at the bottom. So blood from your head, your neck, and your arms flows in through the superior vena cava, while blood from your lower body, so oxygen poor blood from your lower body, comes in through the inferior vena cava. Then blood from the coronary arteries, so the coronary arteries are the arteries that supply blood to the heart itself, into the right atrium. This deoxygenated blood moves from the right atrium, remember our mnemonic RAT, so right atrium tricuspid, so it moves from the right atrium through the tricuspid valve and into the right ventricle in one direction. Now, when the right ventricle is filled with blood, pressure builds within that right ventricle, and the right ventricle pumps blood through the pulmonic valve. So remember our mnemonic RV's pulvans, so the RV PV. right? So right ventricle and pulmonary valve. So blood flows through the pulmonary valve into the pulmonary arteries, which then transport that blood to the lungs. Now remember when I said arteries generally transport oxygenated blood while veins transport deoxygenated blood within the body? Well, here is an exception. It's only within the flow of the heart, blood flow through the heart, that we see that the pulmonary arteries do the reverse. So they transport deoxygenated blood to the lungs. So the lungs then, having this deoxygenated blood, they oxygenate the blood. So they add oxygen to the blood through gas exchange between oxygen and carbon dioxide. So we breathe out carbon dioxide through the process of respiration. Now this oxygen-rich blood that we now have then moves from the lungs to our left atrium through the pulmonary veins, the left and the right pulmonary veins. So here again we see another exception. Here we see that the pulmonary veins are transporting oxygenated blood from the lungs to the atrium, when in every other case in the body, the veins transport deoxygenated blood. So keep these in mind if you're taking your anatomy and physiology tests or exams. Alright, so the blood now in the left atrium moves from the left atrium through the bicuspid valve. Remember our mnemonic lab, so left atrium bicuspid valve. The blood moves through the bicuspid valve to the left ventricle. The left ventricle then fills with this oxygen-rich blood, and when the pressure within the left ventricle increases, it pumps this oxygenated blood through the aortic valve into the aorta. Now remember our mnemonic LVAV. Look, Vera, it's a van. So the left ventricle pumps blood through the aortic valve into the aorta, which then pumps it to the rest of the body. And that is how blood flows through the heart. So remember these few tips. Use the mnemonic lab rat, RV's pool vans, and look, Vera, it's a van, to remember the heart valves, its locations, and the blood flow sequence. Also remember that the right side of your heart pumps blood to the lungs, and the left side of your heart pumps blood to the rest of the body. And even though arteries generally transport oxygenated blood while veins transport deoxygenated blood within the body, when we consider the flow of blood through the heart, the opposite is the case. So here we're seeing the pulmonary arteries transporting deoxygenated blood to the lungs to be oxygenated, while the pulmonary veins then transport or return the oxygenated blood from the lungs back to the heart. So in this case, it's switched. And there you have it, guys. If you find this content helpful, please like and subscribe, and follow my page Nurse Made Easy on Facebook, and share with people who benefit from this video. So take care, and I'll see you in my next one. Bye.